Welcome to Wise Women Wednesday with Brava Women Networking. Today we've got the pleasure of having Vivienne Dean, who is a vibrant 60-something-year-old clinical nutritionist and a personal trainer with 31 years of wellness wisdom. Having navigated her own health challenges, including menopause, a broken pelvis, and autoimmune issues, she empowers women to thrive. Her holistic approach blends integrative nutrition, exercise, including Pilates, yoga, and fitness, and life coaching, intuitively tailoring journeys to individual needs. With a decade running her own studio, Vivienne's compassionate expertise helps you to unlock vitality, balance, and joy, transforming your health and journeys. Today, we're going to be looking at menopause and aging disgracefully and well. Over to you, Vivienne. Thank you.
Hi, dear. Thanks for that wonderful introduction. Welcome, everyone. So this is my passion and my purpose for life. I've been a clinical nutritionist and personal trainer for 31 years, and every year that goes by makes me just more determined to spread the word on healthy aging and that it's possible for everyone to have this. And I will just go into a little bit of details as to how this is possible. And one of my favorite mantras, which I'm happy to share with all of you guys, is that I am getting younger, stronger, fitter, better, healthier, and wealthier as I get older. So I invite you to take that on board. So just going to my first slide. A minute. Moment. Okay, so this is my first slide, and it's just showing you how to be healthy. And we need to understand that as we get older, our bodies needs shift. And I say it's on the decade, but it's not. You would realize that. And for men and for women, obviously I'm speaking more to the women today, but we all have hormonal changes from 35 onwards. So what's it about? What happens? So hormonal changes, our ovaries decline, or rather what they do decline. And it's because our progesterone levels drop, and we have estrogen fluctuations. So that's when we're in perimenopause. And in perimenopause, you will still have some periods. We're not classed as being in menopause until we've actually been free of periods for at least 12 months. But that's the time when you'll experience the various symptoms, which include mood swings, hot flushes. I'm sure some of you in the room may have even experienced these, sleep disturbances, irregular periods, weight gain, and decreased bone density. So I'm not going to cover everything today. I just want to talk about a few things. So I'll be talking about sleep. I'll be talking about bone density and just about ways we can address inflammation, which is another thing that increases when we're in this stage of life. So this, I think, is a great illustration of how women feel at this stage. And if you were going through, I've heard someone refer to this as the seven dwarfs of menopause. Well, we've got 8 there, but yeah, you can probably relate. I won't go into detail. And the other thing I wanted to talk about is about stress. I was looking for a woman with stress, but this is sort of like a, I guess, man or woman. So your hair, you can get male pattern baldness as women through stress. Menopause itself can cause stress in our bodies. It affects our brain. So we get irritability, anxiety, and depression. We get mouth ulcers. our risk of cardiovascular disease as women goes up to slightly higher than men once we are over the age of 50, unfortunately. We can get muscle problems, spasms. So these sort of things in terms of stress can also affect us because of our fluctuating hormone levels. So your lungs can get affected. You may find that you're more likely to get asthma. You're more likely to get pain in the muscles, which is partly because of low progesterone, but also low collagen levels. Digestive issues, and your skin. I won't go into massive amounts of details about this because it'll take too long. But I did want to talk about the difference our food makes. And when we're eating the right way, you can reduce inflammation. So how do we eat the right way? So you'll see here, I've got zucchinis, carrots, I've got brightly colored veggies here. They're all classed as anti-inflammatory food. And at the back, you've got the broccoli. And broccoli is very good because it contains another substance that helps reduce inflammation. So the saying about eating a rainbow every day is absolutely true. So these are the foods I've chosen to illustrate the antioxidants. So the more we can eat a rainbow, the better our health would be. If I had time, I'd tell you what the nutritional content of all these foods were, but it'll take me too long. But yes, you've got those walnuts there, excellent for tryptophan, very good. That's a precursor to serotonin, so they can help with better sleep quality. The blueberries, strawberries, etc., are all antioxidants. Bananas also contain tryptophan, so they're another really good food to have to help you sleep. So they're the sort of things I'd recommend. You know, you could make yourself some cereal. Oats contain serotonin as well. So have it about half an hour to an hour before bedtime. So moving on, we've then got our healthy fats, which are also anti-inflammatory. You can do deep breathing, but I won't talk too much about that today. So fats get a bad rap, but you can see there we've got our extra virgin olive oil, which is loaded with antioxidants. Most of the people here on this planet, certainly in Australia, they have a ratio of omega-6s to omega-3s of 20:1. So in other words, you've automatically got more inflammation in your body. The ratio is supposed to be 2 omega-6s to 1 omega-3. So you can see that we are sadly depleted in all these fabulous good oils. And again, just going on to our pulses. Pulses are extremely good for gut health. They contain cellulose, they contain some insoluble fiber, which help feed the good bacteria in our gut. And on the right side, you'll see I've included a fish and salad. Fish, and I know this won't suit all of the vegans in the room, but fish contain more omega-3s than red and white meat. So I recommend to my clients that they have oily fish at least 3 times a week. If you don't like fish, take a flaxseed supplement or an EFA, essential fatty acid supplement. And there again is showing you good fibers and some antioxidants with the berries. And what is the best way to increase our bone density? Now, I know this isn't one where you can answer questions straight away. So weight-bearing exercise is very good for our bone density. And it's, in my opinion, it's not talked about enough. If Carolyn Smith was on the call, she would be backing me up here. So this is in my own studio. You'll see I've got the weights lined up. This is a beautiful client of mine who's in her 40s, and she's got her youngest there. So it's a good illustration of how easy it is to be at any age staying fit. And just because you've got a baby, that's no excuse. She comes and does PT with me. Sometimes I hold the baby. In fact, I do hold the baby quite a bit while she does her training. She's been with me since since the baby was about, how old was she? 5 months old. And again, you know, we can exercise outside so we get those good endorphins going. And this was a yoga class that I taught in a rotunda in Castlemaine. Walking is another really good way to increase your bone density. And of course, as you saw in the last slide, weight-bearing exercise, hugely important. But do what feels good. So this is me on one of our trips, Lake Burrell, I think that is. And around the lake, there were fitness stations. So I just actively encourage you that it doesn't matter where you are. There's always that opportunity to exercise. And as we get older, it becomes even more important to keep up that good exercise. How am I doing time-wise, by the way? This is another one. Spending
1 minute,
time.
Viv. 1 minute.
Pardon?
1 minute.
1 minute. So spending time in nature, practicing deep breathing and positive mindset. Sleep is hugely important. Seeking better sleep. I've got a whole PDF on sleep. And if you're unsure where to begin, book in a complimentary chat with me. I'm only too happy to pass on some information and give you some useful PDFs. They're all my details. This is what I live. Inside health equals outside vitality. You can find me through my web address anyway, vnutri.com.au, and book in as I said, a chat. I'm only too happy to share my passion. Sleep is even more important as we get older. And if you are tired from regular exercise, 6 times a week of at least half an hour's duration is recommended. But I would say start small, talk to a fitness professional, better still talk to someone who's got the inside health nutted out as well. And as I said, Carolyn Smith in this group can help you as well as me. And we would be only too happy to help continue on, or help you continue on your health journey. Thank you very much for listening.
Thanks, Vivienne. And we'll pop the website down below for anybody who wants to join us. So